Good evening, ladies and gentlemen. This is Dr. Paul. Tonight I want to talk about ganglion cyst. As always, you are welcome to visit our website at www.usmlevideos.net. That is www.usmlevideos.net, where you can browse through hundreds of videos. We have explained thousands of points that are very, very important as you take USMLE examination. And tonight, let me talk a few minutes about ganglion cyst. Ganglion cyst is very important for USMLE examination. You will come across some questions testing you in this area. They are important because they are the most common soft tissue tumors in hand and wrist. And most of the times they do not cause any problems to the patient, but occasionally, especially when they arise on the dorsal surface of the wrist, they cause pain and irritation and limitation or of the range of motion of the wrist, those problems. If they come on the ventral surface of the wrist, sometimes they may not give any problems to the patient, but when they affect certain areas, they may even cause paresthesias and sensation deficiencies on the hand. So this is an important condition in people. There is no age for this problem. It can come at any age, but women have 3 times more incidence than men. So it is more common in women. There is no predilection to any particular hand, and there is also no clear etiology for this problem. It is basically mucoid degeneration of collagen and other connective tissues. It's not covered by synovial sheath. It's actually attached by a stack to the joint. However, it is made up of this mucinous substance, which is clear. So that is the pathophysiology for this problem. Then let us talk about the clinical problems. It causes pain, as I said, paresthesias, weakness, decreased range of motion of the wrist. So those are the main clinical problems. Then what are the standard imaging studies? Actually, in a office-based setting, you don't have to do anything. You identify this cyst just by looking at it. It is flexible, sometimes it is hard, sometimes it causes tenderness, sometimes it does not. However, you can identify these cysts very easily. So there won't be any need usually for any imaging studies. However, you can do a hand X-ray just to eliminate any bone involvement along with the cyst. Coming to the treatment, you can actually do aspiration and steroid injections. The problem is the ganglion will recur. It comes again. You aspirate, it comes again. You aspirate again, it comes again. So this is an annoying situation for both the physician and for the patient. That's why many times you have to just refer the patient to a hand surgeon or an orthopedic surgeon or any kind of general surgeon who can deal with these cysts. And the definitive treatment is total ganglionectomy with the removal of the attached capsule. So excision of the ganglion is the most definitive treatment for this condition. But that's not easy in our world. Many people many people don't have insurance coverage to go to a specialist. So often they end up with the primary care physician who has to do aspiration and inject some steroids to reduce the inflammation. So those are the main points about ganglion cyst. That is the most common soft tissue tumor in hands and wrist that is filled with mucinous substance made up of degeneration of collagen and other connective tissues. There is no age predilection even though it is more common below 21 years. It is more common in women than in men. And the clinical symptoms are pain, paresthesia, weakness, limited range of motion. There are no specific imaging studies, even though you can do X-rays and MRIs just to rule out other things. And finally, treatment, aspiration and steroid injections to start with, and then excision with total ganglionectomy with the removal of the attached capsule. So that is basically about ganglion cyst. If you have more points important and if you think they are important, please feel free to post them in the comment section. And also visit our website at www.usmlevideos.net, where we have posted so many resources for your benefit as you prepare for USMLE examination. We have videos ranging all kinds of subjects covering so many topics you must know before you take this examination. Thank you. Have a good night.